Good afternoon, and thank you for being here today. We do have with us, again, Dr. Joseph Canner from the Office of Public Health. In a moment, we're going to go through the latest examination of the gating criteria slides, looking at the current data in Louisiana, and make an announcement about the proclamation that expires tomorrow, the public health proclamation. First, I wanted to take a moment and thank an awful lot of people across the state of Louisiana for their work with the election that happened this week. And of course, it played out over a number of weeks with absentee ballots, with in-person early voting, and then election day election activities. An awful lot of people, volunteers and poll workers and folks with the Secretary of State's office, you name it. It's a very difficult year because of COVID, but by all accounts, the election in Louisiana was very smooth, especially when you consider all the added complexities this year. So I do want to thank the Secretary of State, Kyle Ardoin, the National Guard, the team at GOSEP, local government leaders across the state of Louisiana, but principally those involved from areas that were hit by the hurricanes. And we actually had a hurricane that hit southeast Louisiana on last Wednesday and still had a number of power outages on Tuesday. But we were able to really minimize the number of polling location changes because the energy companies, Entergy and other electrical companies actually were able to restore service. And where they weren't able to, we worked very hard to make sure the generators were there on time, working, and so forth. And so I just wanted to thank everyone for their work. And it kind of goes to show you what we can do as Louisianans working together in order to accomplish a common goal and something that's really important. And I think it's important to highlight that sometimes because every now and then you get distracted by the things that divide us and so forth. But it's my hope that we will always try to focus on the things that unite us and our shared goals for our state and for each other. And I also want to congratulate all the newly elected officials in Louisiana and those who were reelected. We obviously have a long road ahead of us as we recover from 3 hurricanes, one of which was extremely devastating, and the other 2 were very serious as well. But also continue to respond to the COVID-19 public health emergency. And I would just say that by working together, we can, regardless of our political party or other things, that we can make sure that the state of Louisiana does better and that we can accomplish our goals and move our state forward. I didn't want to have to say this, but we were briefed this morning at a unified command group meeting by the National Weather Service. It's time for people to put their eyes on Hurricane Eta, and because that hurricane is going to move through the Caribbean, across Cuba, and is expected to be in the northern Gulf sometime middle or end of next week. Now, we think it weakens into a tropical storm. We don't yet know a specific forecast as to the intensity, exactly where it's going to go. But if they're talking about the northern Gulf sometime by the middle or end of next week, we have to be paying attention to that. And as we know more, we will certainly let you all know, but you can continue to watch the Weather Channel and tune into the National Weather Service and that sort of thing. So still a lot of uncertainty in the system. It's not till the middle or end of next week, but we need to be paying attention to it. The National Guard continues to have more than 1,000 guardsmen activated in support of emergency operations for Zeta, Delta, Laura, and COVID. And speaking of COVID, just so you have an idea what they do, today there are 25 community-based testing sites around the state of Louisiana that the National Guard is running. CPRA was on the ground yesterday in Grand Isle with Major General Holland, who commands the Mississippi Division of the Corps of Engineers. She works out of Vicksburg. She brought the New Orleans district people with her, but we also had folks from in fact, we had Congressman Graves there, but also folks from Congressman Scalise's office, with local officials like Mayor Carmardell looking at the damage on Grand Isle, especially as it relates to the Burrito Levee on the Gulf side, that southwest side, and they are working on both short-term and long-term solutions to address that damage and to increase the flood protection available on Grand Isle, and we appreciate the work that they're doing. There are no longer any storm-related road closures anywhere in the state of Louisiana. We did have 86 road closures at one time for Laura, 223 for Delta, and 21 for Zeta. Now, there are roads closed for other reasons, and so if you're traveling across state and you just want to know about current conditions, it is always good to check 511la.org. As of this morning, we still have Louisianans in shelters, and I'd ask everybody to keep them in their thoughts and prayers because many of these individuals have been in shelters for a while now, so obviously their lives are not right side up yet. 3,083 total. We also, as part of that, there are 19 Hurricane Zeta evacuees and one non-congregant shelter. It's a hotel in Terrebonne Parish. 2,885 are Hurricane Laura invitees. Evacuees. And 6 of hotels in New Orleans are providing non-congregate shelter. Let me start over. 6 hotels are providing non-congregate shelter. 4 of those are in New Orleans, 1 in Baton Rouge, and 1 in Lafayette. And then for Hurricane Delta, there are 179 evacuees, all of whom are in a non-congregate shelter at a separate New Orleans hotel. So that makes 5 New Orleans hotels altogether. At the mega shelter in Alexandria, there are only 16 evacuees. We will be closing the mega shelter tomorrow. And obviously we are working with all state agencies to help evacuees to transition to long-term housing options. Now, shifting to COVID-19, the current executive order expires tomorrow. Later today, I'll be signing a new executive order, or proclamation, to keep Louisiana in phase 3 with the same mitigation measures in place and restrictions, including, of course, the statewide mask mandate. The order will be in place for 28 days until December the 4th. The data shows, and Dr. Cantor is going to go through this with you in a minute, that Louisiana largely is in a plateau, but with some concerning increases, especially around hospitalizations. And I will tell you, as it relates to plateau, that's relatively good news when you consider what's happening elsewhere, really across the northern hemisphere, but closer to home here in the United States. But that plateau is at a relatively high level of cases. And so we never did get to a lower case load than we had in the trough of our recovery from the second surge. So we're at a relatively high level, but that is still somewhat good news because in comparison to other states. And I think he'll point this out to you when you see there. But we do have areas of concern, particularly around increasing positivity. And that's, as you all know, the first sign that you're on a road to increased cases, hospitalizations, and deaths. And it's increased positivity, especially in certain regions of the state that we'll talk about more in a minute. Louisiana currently has the 44th highest rate of COVID in the country, according to data from the White House Coronavirus Task Force. That's an improvement from 35th last week. Our 7-day average percent positivity is 5.26. I want to tell you all that while that's good news that we're 44th in the country, it is not because we have improved our standing. It's because of the deterioration of other states' standing and the increase in cases that they've had elsewhere. Now, we've been in plateau more or less, and that is, again, relatively good news. But we didn't move from 35th to 44th because we improved. We moved there because other states had more cases. And to point this out, we only have 12 parishes in Louisiana who are not currently experiencing a high incidence of new cases, defined by the CDC as 100 or more cases out of 100,000 in population over the last 7 days. We have had an increase in hospitalizations lately, and especially look over the last 14 days. Currently, there are 636 individuals hospitalized across the state of Louisiana with COVID-19. And to put this into perspective, that's the most we've had in the hospital at any one time since September the 18th. So that's close to 2 months. And while the total number is not especially alarming, we know the nature of this pandemic is such that you're always worse off than your current numbers show, because it takes 2 weeks for whatever is currently happening to show itself in the data. And so that's why you always have to make decisions sooner than you might feel that the data requires. But that's because if you don't do it that way, you have no real chance to stay ahead of the virus. Today, we are reporting 740 new cases on 21,747 new tests. Very unfortunately, we're also reporting 20 additional deaths today, for a total of 5,766 since the start of the pandemic. I keep telling you, I'm waiting for that day, anxiously awaiting the day when I can come up and say we've registered 0 deaths in the previous 24 hours. That hasn't happened. Told you 636 individuals are hospitalized. That's up 13 from the number that we reported yesterday. 82 patients are on ventilators. That's up 5 from yesterday. We know that many of the recent outbreaks have been from small groups of people getting together and letting their guard down. And small gatherings can be less risky than large gatherings, but they certainly aren't risk-free. And if you're having small gatherings with people when you're in close proximity and you're not masking, you're not distancing and so forth, then actually they can pose a bigger threat than going into larger venues where everyone is going to be masking and keeping their distance. And the White House recommendations to us this week, which I think we made available to you all yesterday, specifically point out the dangers associated with these gatherings. And they're doing that in advance of Thanksgiving for a reason. And we'll talk more about that later. But we're also concerned because we know that we had Halloween this last weekend. And while I wasn't trick-or-treating myself, I have heard that there was an awful lot of activity out across the state of Louisiana that did not conform to CDC recommendations and the guidelines set forth by the White House and to the mitigation measures that we've been promoting in Louisiana. And anytime we hear about that, we are on pins and needles over the next couple of weeks, hoping, praying that doesn't show up in the data in terms of increased cases and hospitalizations and so forth. At this time, I'm going to ask Dr. Cantor to come up and to talk a little more about what we're seeing with COVID across the state. It'll be some of the gating criteria that you should by now be accustomed to. And then when he finishes, I'll come back up, finish my prepared remarks, and take your questions.
Thank you, Governor. Good afternoon, everyone. I'd like to start off by echoing the Governor's thanks for everyone that worked so hard to make the elections of last Tuesday a safe endeavor and a successful one. And that goes both for folks that worked hard running poll stations and also for voters. From my experience and what I've been told, people were considerate, conscientious, paid attention to masking and distancing. And that's really good to hear. It also is good news insofar as I think it's clear that for most activities, if we're thoughtful about how we go about it and use the right mitigation measures that we know about, we can do them safely. And that's a takeaway message that I received from the good experience across the state on last Tuesday. On that note, as the governor had mentioned, we are not experiencing the spikes or the outbreaks that a number, really the majority of other states are experiencing right now. That's not, as the governor mentioned, because we're improving, so to say. We've really been holding the course in Louisiana. That's reassuring on one level, but it is also cautionary that I think the second that we lose vigilance, we're going to see ourselves, unfortunately, where a number of other states are right now. The data is going to show that we really have been holding steady for a number of weeks now. And in the context of what's happening around in the country, that's certainly some degree of comfort. So what we'll see on the graph right now, this is the standard gating criteria that we look at every time that we revisit an executive order. This is based on the White House gating criteria, and we look at a few different measures. We look at the percent of people presenting to emergency departments with symptoms suggestive of COVID. We look at the number of new cases coming in every day, the number of new tests that are positive and unique individuals that get reported to us as new infections. And we look at the number of people who are hospitalized with COVID, and we certainly look at the percentage of all tests that are conducted, how many of those are positive. So looking back over the past 14 days for the state as a whole, as you can see from the graphs, and go back one slide, thank you, we are plateauing in all of those measures. So on the top left, you'll see the percentage of emergency department visits for people that have symptoms suggestive of COVID has been flat, really going back a month and a half, if not farther than that. On the top right, you'll see the number of new cases coming in has really been flat ever since we recovered from that big second wave spike right there. And then on the bottom right, you'll see the number of new hospitalizations or people that are hospitalized in the state with COVID has essentially been flat for a good 2 to 3 weeks right now. All of that is encouraging. I will say we're now 3 days in for successive increases in hospitalized COVID patients. And I would venture to guess if we ran that bottom right graph in a couple of days' time, you might see it be a slight increase. So all of the success that we have is highly tenuous, and that's a message that we're going to have to take home with us. Next slide, please. This is, I'm going to take folks back to the last time we had this conversation, which was September 30th, and you'll note that you see a lot of green and some plateaus and really a small amount of red on that schematic there. Next slide, please. This is the most up-to-date version of this. On the top line, you'll see all three measures are plateaus for the state: COVID-like illness, new cases, and hospitalizations. COVID-like illness is plateauing statewide and more granularly in all 9 regions of the state. New cases are plateauing in the statewide. They're decreasing in the New Orleans area. They're increasing in the Baton Rouge area. They're decreasing in Region 3, the river parishes. They're plateauing in Regions 4, 5, and 6. They're decreasing in Regions 7 and 8 and 9. I do want to mention one thing about Regions 7 and 8, which is the Shreveport area and the Northeast area. Although technically over the past 14 days, new cases are decreasing, if you were to look at the map, which folks can pull up on the LDH COVID dashboard, you'll see that it's a recent decrease in a context of, number one, very, very, very high levels of COVID, and actually larger increases a little bit earlier on the timeline. So don't take a ton of solace that it says decreasing there, because the amount of COVID in those regions in particular remains very, very high, and that's a risk for us. We move over to the far right and hospitalizations. As we mentioned, it's technically flat and plateaued for the state right now, but again, we're now 3 days of consecutive increases, and we do worry that that might become a small increase in the near future. We do have small increases in regions 1, 2, and 3, and decreases in region 4. It's flat in region 5, increasing in region 6, decreasing in regions 7 and 8, and then increasing a little bit in region 9 as well. All told, that's a relatively encouraging picture considering what else is going on in the country right now. but we're nowhere near out of the woods. We have a lot of COVID in Louisiana, a lot of risk right now, and the only reason why we're not in a worse place, relatively speaking, is because of people following the common sense mitigation measures. Next slide, please. What we'll do here is just look at hospitalizations, the top green line going over time. Folks will notice the big spike on the far left. That was late March, early April. Then we came down to a plateau. Then we went up to the second spike in late July, late July, early August. Then we've come down, and we've essentially been plateaued up until, like I mentioned, the past few days where we're seeing just the suggestions of an increase. Something to keep in mind with the hospitalization data is that it really is a lagging measure. And when you start seeing cases go up, you can be assured that you're going to see hospitalizations go up probably a couple weeks after that, because it takes time for people to build up sickness enough to be, requiring hospitalization. So it lags what's really going on with cases by a good couple weeks. That said, it's pretty clear when you look at this. We entered into phase 1 on May 15th. We entered into phase 2 on June 5th. We entered into phase 3 on September 11th. And when you map those out, you can really see that as people in Louisiana began following the mitigation measures with increasing amounts, masking, distancing, and hand washing, it really has been effective in bending our curves and reducing the spread going down. What we've learned over the past few weeks, and this is coming from contact tracing data that we have and in discussions with our regional medical directors across the state, is we're seeing a number of more cases from individuals who likely got exposed in either small gatherings, as the governor mentioned, or in settings with people that they were familiar with, distinct from perhaps earlier or in other accounts where we had big, quote unquote, super spreader events. I wanted to give a few examples of this, and these are coming straight from our regional medical directors over the past couple of weeks of conversation. The first is we had a football team, a high school football team, who actually, they were doing everything right during practice and games. They were very cautious during practice. They were distancing. They had good mitigation protocols during games. They had an after-game event. They got together in someone's backyard after the game, and that's where a lot of transmission happened. And the whole team, and there were a number of cases. Thankfully, no one got very sick, but the whole team had to quarantine, had to miss a couple games. That's one example. The second example that we've talked about, there's a particular elementary school that had to put in-person classes on hold for a week or so because a good number of the teachers got together after hours, had a dinner party, and there was transmission within that circle. And so enough of the teachers had to be out that the school had to put classes on hold for a number of days. And then the third example that we've heard in increasing frequency is transmission linked back to churches and other houses of worship. What we have internalized from this is that I think when people are with others that they feel close to or in familiar settings that they feel comfortable with, their football team, their close coworkers, their church, I think they tend to let their guard down a little bit and not recognize that the risk is just as much in that setting as it is elsewhere. Remember, up to is about 50% of people infected with COVID are going to have no symptoms, no suggestion that they're ill. So when you look at it from that perspective, it really doesn't make a difference if you know someone, if you feel close with them. They can just as likely be infectious and confer that transmission to you. So the message that I'd like to convey is, even if you're in a very familiar setting, whether it's close friends, your teammates, your church, the risk is equivalent. The risk is just as much there as it is if you were with a group of strangers. That's the strange thing about COVID with the asymptomatic infections, is you just don't know. And I think we will do better as a state if we're able to maintain that vigilance even when we're in familiar settings. As we look forward to the Thanksgiving holiday and as families go through the motions of what they're going to do, how big or small of a gathering they're going to do, how much deference they're going to give to vulnerable members of their own family, and perhaps change their normal plans, I'd like families to please keep that in mind, that we are seeing increases in accounts of transmission in very comfortable, familiar settings. And there will be a risk during Thanksgiving that families really do need to account for and think hard about what the right decision for their family will be. Thank you.
Thank you, Dr. Cantor. So as the holidays approach, we're going to continue to ask people to get their flu shots. More important this year than ever before. And so even if you're someone who typically or maybe has never gotten a flu shot, please change that this year. And if you get a flu shot now, then it should be in full effect by the time that Thanksgiving comes this year. We are very thankfully around the state of Louisiana right now seeing far fewer people with flu than we typically would. And I believe fewer people in Louisiana with the flu than other states around us this year. And as we mentioned before, the mitigation measures that work to prevent the transmission of COVID-19 also work to prevent the transmission of the flu. So please continue to follow all of those measures, but also get your flu shot this year. With respect to the holidays, now is when most families start deciding, okay, where we're going to go for Thanksgiving, who are we going to invite over, and what are our activities going to be. I'm encouraging everyone to please be mindful of this public health emergency, to understand that the outbreak that we've seen around the country has happened because the weather has gotten colder. People have come indoors to spend more time in close proximity to one another, and the disease is being transmitted. And so when you put that information into a perspective with respect to the upcoming holiday, you know that it presents a real threat to public health in Louisiana. And so please take all of this into consideration as you plan your holiday activities. I come from a very large family. There were 8 children in my family. We're accustomed to always getting together for our holidays. My holiday this year is going to look very different, and I'm not happy about that. I would give just about anything to be able to go back to normal and having those very large family gatherings. But one of the things that I won't give is I won't give away the safety and the health of my family members, especially those who are vulnerable to this disease. And there's not a family of any size in Louisiana who doesn't have people who are vulnerable. So let's just please be very conscious of all of this, and let's be intentional. And by the way, there's really no reason to think that Christmas is going to be any different in this regard than Thanksgiving. So start having those thoughts and those discussions in your family as well, because we want everyone to be safe. And Thanksgiving is obviously a time to count our blessings, and as difficult as this year has been, whether it's the hurricanes or the COVID or many other things, we do all have plenty to be thankful for as well. And I know that our families are going to gather around the table again. And when we do, we're going to have plenty to talk about. But we shouldn't be doing it this year like we have in the past. I did want to show you one more slide. And this is what's happening with our neighbors in other states. And so you can see that we're doing better than most of the country and our neighbors right now. Again, it's not because we are doing better relative to where we were weeks ago. It's because other states are increasing in their cases and so forth. But like Dr. Cantor said, any progress we've enjoyed, any stability, it's always tenuous. And if we let our guard down, then we know that there will be more transmission. We know the positivity rate's going to go up. There'll be more people getting sick and in the hospital and eventually dying. But we can choose our path. We can't control it completely. But what we know, and this is not theory, this isn't somebody's idea. I mean, we've lived through this long enough now, and we know for a fact the mitigation measures work. So if we want to enjoy the most normalcy that we can without having people get sick, that's unnecessarily and unreasonably so, then we engage in the mitigation measures. If we want our businesses to be open to the maximum extent possible, have the fewest restrictions on there, then we can do it. We can do it safely. But you do it with a mask on. You do it from 6 feet apart from people who are not part of your immediate household. You wash your hands frequently with soap and water. You stay home when you're sick. And then we're all very mindful of protecting those people who are vulnerable. If we will do that, then we're going to be able to get through this just fine, and we can continue to keep our counts relatively low, and we can save lives. In short, and I've been saying this for a long time now, but it really is this simple. If we are just good neighbors to one another, as that is defined during COVID-19 times, then we're going to get through this much better. And we also will get through this without having to go back to previous levels. We don't have to go back to phase 1. We don't have to go back to phase 2. We don't have to impose new mandates and restrictions if we will just do those things. Now, if we don't do those things and we end up with more transmission than we would otherwise experience, and our hospitals are threatened with not having the capacity to deliver life-saving health care, then if necessary, we are going to go backwards. But we don't have to. And if the people of Louisiana will continue, and quite frankly, I know that there are many folks out there who are not following the mitigation measures as they ought to. And I'm encouraging them to do so. We can do better. We don't want to go backwards. And other states, including some of our neighboring states, have recently started going backwards in terms of restrictions and mitigation measures. We're trying not to do that. And lastly, some people believe that when you show progress in your fight against COVID-19, or that when your situation here in Louisiana is better than it is elsewhere, then it's time to remove the restrictions and the mitigation measures. Well, I just want you to think about that for a second. If the reason you're better, at least on a comparative basis, is because of the mitigation measures, where do you think you're going to be if you remove those mitigation measures? If they are because of the restrictions, where are you going to be if you remove the restrictions? And far more damaging to our economy than maintaining the status quo going forward is to threaten the ability of our healthcare delivery system to deliver life-saving care and have to go backwards in terms of restrictions, because you're not inspiring confidence for people to come visit your state and that sort of thing. So we just need to get through this. We need to follow the data, follow the science, adhere to the guidelines, the recommendations that we're getting from the White House Coronavirus Task Force, and that's what we're trying to do. And I do want to thank the people of Louisiana because it is no accident that we're doing a little better than our neighbors in the rest of the country right now. It is because of you. And just think about how much better off we would be if everybody was engaging in all of these mitigation measures. All right, so with that, I'm going to pause and take a few questions. We're going to have our next press conference on Thursday of next week. Tomorrow, I'll be traveling down to Port Fourchon to look at some of the damage that was done there by the recent hurricane. I'll be meeting with some folks down there. I just wanted you to know that I was originally going to be going down to do some CPRA work, but the storm kind of knocked that off of the calendar for a bit. We're going to put it back on, but I'll be down at Port Fourchon tomorrow. So I'll take questions. Yes, sir.
Governor, there's some thinking that this election might help accelerate the trend of people wanting to vote early and by mail because they did it this time and they liked it, and I've seen this trend for a long time. Do you think any of the changes we put in place this year, extending the early voting period and extending the time to process mail ballots, need to be put in place permanently in Louisiana?
You know, I don't know if they need to be put in place permanently, but I do think we need to have that discussion. First of all, it'd be great to hear from the people of Louisiana whether the increased early voting time period, for example, is something that they really enjoyed, that they took advantage of it. They think it's important going forward. and in any other things that we did for this particular election, which we did because of the public health emergency, by the way. And so if we can see what the voters might want to keep and see what the impacts of that would be and whether it's in order, so long as we can have elections that are that we have confidence in, and we ought to extend every, I think, reasonable convenience to the voters because we want to promote people voting. We never want to make them have to decide between risking their health in order to cast a ballot or forfeiting their right to vote. And we were able, I think, this year to thread that needle and get that done in an appropriate way. But outside of the public health emergency, which of these measures we might want to keep, that's something that I would be very happy to have conversations about with the Secretary of State, with legislative leadership, and so forth. I'm interested to know, because I don't know yet, how many additional mail ballots were actually cast this year as a percentage of the total vote, and then compare and contrast that with previous elections. I haven't received that sort of granular data yet, but I'd be interested in seeing that. And again, we just need to make sure that we can ensure the integrity of our elections so that people can have confidence. But if we can do that and make it more convenient for voters, then I think that's something that we ought to consider. Yes, ma'am.
Governor, obviously there is an ongoing lawsuit with the House Republicans over the petition. I'm just wondering, did you reach out to the Speaker and to the Senate President in advance to notify them that you were announcing this extension, and what kind of reaction did you get?
We did, and in fact, we had the conversations with them before we renew proclamations that we always have. In this case, it wasn't me personally. We had our gating criteria meeting yesterday, made our decision yesterday, and then individuals in my office spoke to both the Senate President and to the Speaker, provided the data that we were making the decision on and so forth. And it was a little bit different for a couple of reasons. One of just had to do with my calendar today, and then the other is the litigation that you just mentioned. Because it's sort of odd, but because the Speaker is actually the one who initiated the litigation. He's a represented party, and so we have to be just a little bit careful about how we communicate, which is a little bit unfortunate. But the communication did happen after my executive counsel spoke to counsel for the Speaker, just to make sure that they approved that taking place. Yes, ma'am.
So what is the state possibly going to do to help some of the workers who are going to be losing their jobs at the Shell refinery, since they're going to be reducing staff as of right now?
Yeah, first of all, and that was a very sobering announcement that Shell made today about the refinery there in St. James Parish. And we're going to do everything that we can. First of all, Shell is as well. I spoke to Shell company representatives yesterday, and they're going to absorb as many workers as they can at other Shell operations across Louisiana. Those people who are eligible to retire are going to be given special incentives and that sort of thing. Well, we're also going to be working through the Louisiana Department of Economic Development and the Louisiana Workforce Commission to try to connect as many of those individuals, because there was about 700 employees in all, as many of those individuals with other employment opportunities before they actually get laid off at Shell. And Shell is cooperating with that. We hope to put a transition center on place at the refinery so that we can better communicate with and direct these individuals, those folks who might have a job opportunity, but for the fact that their skill set isn't what it needs to be, we're going to try to see if we can get them some special training. And so we're going to do everything that we can. Obviously, this very disappointing announcement from Shell, and it's one that reflects a new global strategy where they're going to condense down to, I think, only owning 5 or 6 refineries across the world. And all of those are going to be co-located with other chemical manufacturing facilities. And so this particular facility kind of stood out and just wasn't one that made the cut. Obviously, we're disappointed in that, but we're going to work as hard as we can to connect these individuals with other employment opportunities. And hopefully that's going to be a little bit easier along the river, because that's where we have more opportunities, generally speaking, than elsewhere. And so in terms of the geographical proximity of where these people live, we hope to be able to get them a job in that area and in the near term as well. Any other questions today? Sam?
Along those same lines, cited the fact that they're moving towards green and renewable energy, and they want to create these sites that have, the ability to create that sort of renewable energy. What does that say about Louisiana if they're not, expanding their renewable energy plans here? What do we need to do to land more of that in Louisiana?
First of all, we're landing significant investments in Louisiana around climate change initiatives and renewable energy, things to clean up the environment, especially the air. So carbon dioxide capture and storage. That's something that investment is coming into Louisiana as we speak. We are situated probably better than any other state in the country to take advantage of this because we produce carbon here, but also because we have the pipelines to transmit it, but we also have the geologic formations to store it. And so we're already starting to see investment come to Louisiana now that Congress has passed the 45Q tax credit that has received all of the rules now from the U.S. Department of Treasury. So we are starting to see that. We created a climate task force that we unveiled recently to start talking about these things. And it is very interesting that the companies we think of as oil companies are really trying to rebrand as energy companies. Now, oil and gas are going to be very important for decades, but we know that there is going to be a transition over decades to more renewable energy. And so we are trying to accommodate as much of that in Louisiana as possible, but while still trying to take advantage of the fact that we are a gas state, that we are an oil state. And so we're working with these energy companies on a daily basis. And these are conversations that I've had with Shell. You just mentioned Shell, but with other companies as well. And you're going to see more efforts to do this going forward. Yes, ma'am.
It's emergency elections bill. Yes, SB 20.
Well, I will tell you the short answer is no. There are some things about the bill that I actually think would be an improvement over existing law, but there are some very concerning things. And I actually called her the other night to share that with her. For example, it allows members of the legislature to register their vote with an emergency election plan by text message. That's problematic for me. And there are some other challenges with the bill, and so I'm still looking at it, trying to make that final determination. But as I mentioned, there are some parts of the bill that I think are an improvement. So for example, I think it rightly says that if I were to register an objection to the Secretary of State's plan, that the legislature could basically override that objection, but it would require both the House and the Senate operating by 2/3 each to do that. That's the right balance between the executive branch and the legislature. And so that actually is an improvement over existing law, but the idea that legislators would be able to do this from wherever they happen to be across the state via text message or potentially email and so forth, I think is problematic. And there's some challenges around the constitutionality of that as well, because there's no doubt in my mind that the legislature would intend for that action to have the force and effect of law. Well, the legislature says the Constitution says if that's what they want to do, they need to meet in person in Baton Rouge. Yes, sir.
Do you still
Who am I voting for what?
Congress, 5th District.
I don't know. But I do vote in the 5th District. But I don't know who I'm voting for. I can tell you I will vote because I always vote. But I don't know yet. Yes?
So is there going to be any changes with this new extension with phase 3 or no? Is it just going to be the basic same protocols?
We think we've got the balance of things about right for now. Again, we're in a plateau. We're not improving, but we're not getting worse either, except for maybe the past few days, and it bears very, very close watching. But it appears, for example, that the plan that we had to open bars in parishes with low levels of community transmission, and then to limit the occupancy and make sure the patrons were seated and to limit the hours, make sure that 18 to 21-year-olds can no longer go in bars, that appears to be working based on the information we're getting and the contact tracing that's taken place. But I'm not yet prepared to either remove those restrictions. And part of this has to do with personal conversations that I have with members of the White House Coronavirus Task Force, along with the recommendations they send to me that we make available to you all. When you look at what's happening around the country and what we have some reason to believe will soon be here in Louisiana, now is exactly the wrong time to remove these restrictions and mitigation measures. And really, we need to be very, very careful through the end of the year, get into the heart of the flu season, but also what should be the very toughest part of this. I really don't know whether to call it the second wave or the third surge, but y'all know what I'm talking about that's happening around the country. And this was a message that Dr. Burks delivered when she came to LSU recently, both privately to me, but also to everyone else who was there, is we have to be very, very careful between now and the end of the year. As the weather gets colder, more people are indoors. And part of the reason we had a summer surge is because the weather got so hot and humid that people went indoors. So we just have to be very, very mindful of that. Look, I want to thank you all for continuing to cover all of these important matters. And I want to thank the people for Louisiana. And I want to, just say again, I haven't made a single decision relative to COVID-19 that was easy. And I know that there are people who don't want to wear a mask. They don't want to be told that they should stay 6 feet apart from others and that sort of thing. Look, I get it. But the science is very, very clear. And our experience in Louisiana now is extremely clear. These measures work. And what we cannot do is unnecessarily expose our neighbors to this disease and to transmit this disease more than we otherwise would. And in the grand scheme of things, a cloth mask is a small price to pay. And I want to remind everybody, if you say, well, I might wear a mask, but I'm going to wait till I feel sick. 40 to 50% of people with COVID never feel sick, but yet they have the disease and they are contagious. And so if you say, I'm going to wait till then, there's a really good chance that you've transmitted the disease, including to people who are vulnerable. And so that's just not a smart thing to do. And so we're asking everybody to be a good neighbor. Wear your mask, wash your hands, physically distance when you're with people who are not from your immediate household, stay home when you're sick, and let's make sure that we protect the most vulnerable. And we're going to continue to work this as hard as we can, but also as smart as we can by trying to strike the right balance between public health on the one hand and the economy and people's livelihoods on the other. And with the cooperation of the people of Louisiana, we're going to get there. And when this ends, I don't know. Sooner than later, I hope and I pray. We're working very hard to make sure in Louisiana we're going to be ready if and when there's one or more vaccines that need to be distributed and administered so that we can hasten the day when we can put this in our rearview mirror. But we are not there. And when you make progress, that is not an indication that you need to remove the measures that actually allowed you to make the progress. But that requires patience, and and I get it, it's hard, but that's just where we are. Look, I want to thank y'all, and we'll look forward to seeing you next Thursday. In the meantime, pay attention to the weather. Let's see what happens with Zeta, and if the worst happens with it, we'll be talking to you before Thursday of next week. God bless.